Hi, my name's Heather Reeve, and I'm going to be assessing my patient. His name is Justin. He's a 58-year-old male, and he's been diagnosed with Stevens-Johnson syndrome. Hi, Justin.
Hi.
I'm your nurse. My name's Heather. I'm going to ask you some questions and do an assessment. Is that okay?
Yes, that's fine.
Okay. Have you had any past history of skin disease?
No.
No? Have you had any excessive dryness or moisture on your skin?
Yes.
Where at?
All over back, stomach, and legs.
Have you had any skin itching?
Yes.
Has it been mild or intense?
Intense.
Does it awaken you when you're sleeping?
Yes.
Where is the itching at?
All over back, stomach, and legs.
When did it start?
A week ago.
A week. Have you had any other pain or soreness?
Yes, where blisters are.
Where the blisters are at? Where did the... Okay. The blisters are on your stomach, back, and legs as well that started? Okay. Any bruising at all?
No.
Okay. Have you noticed any skin rash or lesion?
Yes.
When did it start?
A week ago.
1 week ago. You got the rash about the same time as the rest of the symptoms. Okay. Where is it at?
Upper back.
Upper back is where it started. Where did it spread to?
All over my face, stomach, and legs.
Okay. What medications do you take?
Protonics, prednisone,
Digoxin?
yes.
Okay.
Lipitor, Lasix, allopurinol.
Allopurinol. Okay. Anything that's been a recent change?
Allopurinol.
Allopurinol's new for you. How long have you been on it?
About 3 weeks.
About 3 weeks ago you started it? Okay. So and this is just different. You should also do a really good skin assessment, which is good. You know that where the rash is and where the blisters are, and you see where it's starting. So you've been doing good. Just make sure we're going to keep observing it and watching where it spreads, okay? I'm also just going to look, starting at look over your skin, and I know it's painful, so I'll try to be careful and nice, but we're just looking at the skin of where I see any rashes or bruising on your hands and arms. And then I'm going to look at your chest and your legs. Can you sit up and I'll look at your back? Is that painful?
Mm-hmm.
And I see where you've got some redness, rash, and the blisters that are all over your back and your belly. Go ahead and lay down. You've also, I've noticed when we took your vital signs, you've got a little bit of a temperature. You do have some moisture. Your skin is wet, and that's probably from the blisters. A little bit of edema in the lower extremities, and the lesions are just the blisters, and they're mostly right now on the chest and the back, lower back. All right, Justin, with your eyes, have you had any difficulty seeing, like blurring, blind spots, anything like that?
Some blurring.
A little bit of blurring. Are you having any pain in your eyes?
Yes.
Okay. What kind of pain is it? Is it stabbing pain, burning pain? Just kind of achy pain?
Yeah.
Okay. And I see it's in your eyes. I can see a little bit of redness by looking. Are you having any water in your discharge from your eyes? You've got a little bit of watering and discharge when you're sleeping. Have you had a history of eye problems?
No.
No history before. Okay. Have you ever been tested for glaucoma?
Yes.
Do you wear glasses or contacts?
No.
Are you taking any medications for your eyes?
No.
No medications. Good. All right. So I would inspect your eyes, which we already did, but looking at the conjunctiva and sclera. Also, I will inspect the anterior structures of your eyes, looking at the eyebrows, the eyelids, checking on those. You have a little bit of redness on the bottom. And then using an ophthalmoscope, I would inspect the ocular fundus, and most likely I will see that you've got some damage to the optic disc. But I don't have an ophthalmoscope with me. So, for your breathing, do you notice you've had any coughing?
No.
Okay. Any shortness of breath?
A little.
Are you having any chest pain with breathing?
No.
No. Do you have a history of respiratory infections?
No.
Okay. What about a history of smoking?
No.
And have you ever been exposed, like where you work or where you live, to environmental exposure to breathing problems, or like working factories or anything like that, or somebody else that smokes?
No.
Okay. I'm going to listen to your lungs. And I know you've got the blisters and the rash, so I'm going to be careful when I put this on your bare chest, okay? All right, can I get you to sit forward and I'll listen to your back? Let's take off your robe. And I'll listen to your bare chest, back. If you could take some deep breaths for me. Okay, go ahead and sit back. So I've visualized the anterior and posterior. Also, I'm palpating the chest. And then while auscultating the lung sounds, they were clear, and little crackles in the bottom bases, but the upper and middle were clear. Respiratory. Checking the pulses and then checking the oxygen. Let me get your finger adjusted. Respiratory rate of 20, he's got a pulse of 90 or pulse of 69, and oxygen is saturating at 97%, and he's on 3 liters of oxygen. Have you noticed a decrease in your appetite?
Yes.
You have? Are you noticing any trouble with your swallowing?
Yeah.
Okay. All right. That is the completion of my assessment of my patient, Justin. Thank you.